Hello, good afternoon. My name is Yvonne Agbo, and welcome to the Student Health Show. I'm here with
Marianne Tinita Safon.
who is a fellow healthcare professional. So today we're going to be talking about. Antoinette, do you want to tell us what we're talking about?
We are talking about the dangers of self-medication.
Yes, please.
Yeah.
So, self-medication is basically when you are taking drugs without the counsel of a healthcare professional. And the problem with that is that you may end up taking medication for the wrong thing, or you may end up taking the right medication but the wrong dose. And you're not aware of the side effects of the drug as well. So it could lead to medical complications. Antoinette, there's something you want to add to that?
I think you said everything on my mind.
Yes, please. So, regarding the taking the wrong dosage, things like paracetamol and like pain medications, especially for the students who are always getting headaches in school. And once you get a headache, you're like, oh no, it's the stress. You've diagnosed yourself, and then you're going to take para.
True.
Yeah.
So true.
There's a limit to how much you can actually take before it starts affecting your liver and all those kind of things. Yeah. Antoinette?
So why do you think people self-medicate?
Well, personally, I don't like waiting in the hospital, like the queues. So, when I think about having to go and wait, I know what's wrong with me. And I can Google the symptoms and be like, oh yeah, that's it. Yeah. Or like refer to one of the classes we had. I'm like, oh, I remember when they said this. This is definitely the diagnosis. Yeah. So, that happens a lot. And then for the side effects of the drugs as well, you are self-medicating and then suddenly you have like diarrhea or constipation, which may be a side effect. But then now you're also taking medication for the side effects, which is also going to cause like more problems as well. So, it's a slippery slope.
Yeah. And I feel like sometimes I just self-medicate because I think I know what I have. Or maybe I don't want to go and hear them telling me that I have something. So, I'll just try and sort it out. And if it goes, I'm like, okay. Because I feel like, should I say course? But I feel like we as students, or we learning everything in like, as our journey, as we are going, I feel like when we read some of the slides, we feel like,
this is me.
Have.
Yeah.
So then, but I think sometimes it's not good because we end up scaring ourselves too.
Yeah. I feel like the worst part of the self-medicating is like you may be hiding like what is actually going on. So if you keep having like stomach pain, it could be pointing to something else, maybe like an ulcer or something. But you're like, oh, I ate something bad, and then you go and like take some antacids and things, and you're like, oh, I'm fine. And the more like you put it off, then when you eventually get it diagnosed, it's already like quite progressed, right?
Yeah.
And that's something like we tend to see a lot. So that's like the worst one, I think.
I remember my auntie came and I think I was like, my head is hurting. Someone was like, go and take medication. She was like, Ghanaians, why do you like paracetamol like that? And she was like, at least go and
Para
drink
fixes
water.
everything.
Yes, I know, right?
Para
It
fixes
does.
everything.
She was like, go and drink water. And I realized that when my head hurts and I drink water, sometimes it's just telling me I'm dehydrated. Sometimes you just need to rest. But sometimes you just want a quick way because you have so much
to do.
Yeah.
All I try to do is when I get a headache, I always like try to take a nap, eat food, take a nap. But like that's my solution for everything before I reach for like medication. I think it really does help. Sometimes it's just like headache hunger. Actually,
yes, it does. Sometimes I'm just hungry. I think yes, it happens.
It
to
really
me.
happens.
Yeah.
Yes, please.
Okay, so I know self-medication is like. Should I say self-medication or self-medication? Or both of them are the same?
Either works.
Okay. But do you think, I know that is when we diagnose or take medication without seeking medical advice. But then if, let's say, you have an auntie, an uncle, a doctor who is in a different region, a different country, and you are sitting and you're like, okay, this and this and this is what I have. Do you think that's also like, that can be put under self-medication? Or
If the person is still in the healthcare, like part of us. I think no, it's not self-medication, but also it's not the best way to go about it. Because your doctor actually has to see you. Like, where we assess is like history, examination. Yeah. Examination is a big part. You can come and be like, oh, I have a headache. It can be a million things. That's exactly. So examining the patient also helps you like come up with a diagnosis. But then you just like texting somebody, you're like, oh, I have this, and that. I could tell you have Lassa fever, but like, I'm sure it will not be Lassa fever. So yeah, I think it's best like going to an actual like hospital. It really does happen a lot. My auntie is a pharmacist, and the amount of times that my mom is just like, oh yeah, so my son has like, oh, cough this. And my auntie's like, oh, let him take this. I'm like, you people, I'm in the house. You can't do this. We have to go to the hospital. No, but they don't. They tend to take it very. That's where we are in Africa. So,
but doesn't this happen to you? I remember I went home for vacation and my auntie so much like, oh, now my knee is hurting. What medication should I take? I was like, see, I haven't reached that stage.
No. But it's always also funny because like your knee is hurting. There could be like a billion things. You have to give me something more. I don't do magic over here. So your knee is hurting. Like, is it swollen? Is it? You see. So there are things you actually have to ask. So yeah, it's always better like one-on-one.
Yeah. But I think adding to you saying you don't want to like wait the long lines in the hospital, the long waiting time, I think sometimes too due to costs too, because doctors are not magicians or healthcare workers are not magicians. Sometimes they might make you do a test and there'll be nothing in it. But they need to do it to rule out stuff. So I think you just try as much as possible to.
Healthcare is not cheap.
It is.
Even for the doctors, healthcare is not cheap. I can tell you how many doctors like they keep complaining. They're like, we are the ones with the knowledge. But if a doctor falls sick right now, they go through the same things that all the patients go through. That's for our government. That's that's not something we can fix.
Yes, we can. Hopefully.
Yeah. But as a student, it should be like part of we have like a student clinic, right?
Student clinic,
exactly. You don't go to the student clinic.
Monday is the worst day to go to the student clinic.
I've been to the student clinic like 3 times, and it was very helpful all those times because I didn't have to pay for everything. It was just part of the package.
Like Mondays are the worst days to go there because everybody has come with their problems from the weekend. Sometimes, like I went there, I think Friday or Thursday, they told me that their system is down. I came back 30 minutes.
The system is always down.
So I just sometimes feel like if you have the means, just
go somewhere else.
To the main hospital.
But if you don't have the means, then the student clinic is...
Because they are the same, they are doctors.
Exactly. So that will help with like the cost problem. Yeah. So, I was also thinking that usually, you know how drugs have like drug interactions? Yeah. So like some medications that you may take may make like one medicine not work as well or work even higher than it's supposed to. So if you don't really know like which drug can affect which, then like self-medicating can really turn into like a big problem.
That's true.
Yeah, and like the damage to the organs is not a joke.
That's true.
Dialysis is
so expensive.
Expensive.
It's really crazy.
It's so expensive. And like if you damage your kidney to the point where you need dialysis, that's like once a week. Is once a week or once a month?
I think the dialysis.
Yeah.
I think it's supposed to be 3 times
a week.
Yes.
Oh my goodness.
But I think because they said like due to financial things, like people usually do like
that's
twice.
Wild.
It's really wild, and the cost.
And you're going to have to do that for life if your kidneys are gone. So please, you guys, let's try to take care of ourselves and the medications.
Yes.
It's very easy to pop it. The consequences, they are not as easy. So it was very lovely having you, Antoinette, here today.
Thank you for having me.
We hope we get to see you again.
Yes,
please.
You will. All right.
So from Yvonne and from Antoinette.
Yes.
See you later.
Bye.
Bye.